Untreated borderline personality disorder. A path to instability. Borderline personality disorder, BPD, is a serious mental health condition characterized by intense emotional instability, distorted self-image, and impulsive behaviors. If left untreated, BPD can profoundly disrupt a person's life, leading to chronic relationship problems, career setbacks, self-harm, and an elevated risk of suicide. While treatable, the consequences of inaction can be severe. The core challenges of untreated BPD is rooted in difficulties regulating emotions and maintaining stable interpersonal relationships. Individuals with BPD often experience a black and white worldview, rapidly shifting between idealizing and devaluing others. This instability manifests in volatile relationships, job instability, and a pervasive sense of emptiness. Why it matters? BPD affects an estimated 1.6% of the adult population, with women diagnosed more frequently than men. A history of childhood trauma or neglect significantly increases the risk, suggesting early intervention is critical. The disorder's complexity often leads to misdiagnosis as bipolar disorder due to overlapping symptoms, delaying appropriate treatment. The downward spiral. Consequences over time. Without intervention, BPD symptoms worsen over time, creating a cycle of chaos. Relationship turmoil. People with untreated BPD struggle to maintain healthy relationships. The fear of abandonment drives erratic behavior, including cutting off contact with loved ones to preempt rejection. This creates a self-fulfilling prophecy of isolation and conflict, leading to frequent breakups, divorce, and strained family ties. Career instability. Impulsive behaviors associated with BPD such as reckless spending, substance abuse, or emotional outbursts often lead to job loss. The inability to manage emotions can render consistent employment nearly impossible. While some individuals with BPD may function well despite the diagnosis, many experience severe instability in their professional lives. Self-destructive behavior. Self-harm, including cutting and suicidal ideation, is alarmingly common among those with untreated BPD. Studies show that up to 10% of individuals with BPD die by suicide, a significantly higher rate than in the general population. Often, self-harm serves as a desperate attempt to cope with overwhelming emotional pain, sometimes leading to crisis intervention and belated treatment. Reckless impulsivity. Untreated BPD can drive individuals toward dangerous behaviors such as substance abuse, reckless driving, and indiscriminate sexual encounters. These actions stem from poor self-image and a lack of impulse control, resulting in health consequences and further instability. The path to recovery. Treatment works. Fortunately, BPD is treatable. Psychotherapy, particularly dialectical behavior therapy, DBT, is considered the gold standard. DBT teaches skills in mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. Medication can also be used to address co-occurring conditions like depression or anxiety. Key takeaway: roughly 3/4 of BPD patients respond positively to treatment. However, therapy requires commitment, at least 6 months to a year of weekly sessions, group training, and crisis coaching. The bottom line: untreated BPD is a recipe for instability. Without intervention, individuals with the disorder face a high risk of relationship failures, career collapse, self-harm, and other serious consequences. But the good news is that effective treatments exist. Seeking help is not just possible, it's often life-changing.